Heart health is a very special topic to me because without the heart, um, many organs will not function. Yes, the heart has to get that blood pumping so that oxygen and other nutrients would get to the other vital organs. So the heart is very important. And guess the first organ that suffers when the heart doesn't function well is the brain. Yay! It's the brain. Neurologist, yes, you're at first when the cardiologist don't do their work. So the heart, when the nutrients are not supplied to the vital organs, just simple glucose. If the brain does not get glucose readily available, yeah, people get syncopal, you drop. And that's why when people pass out and the ambulance gets there, the people, the EMT people, they check for airway, breathing, circulation, and make sure glucose is adequate. Because if glucose is low, the brain will get weak, foggy, weak, and give up. So we have to really make sure our heart is healthy, our heart is good. And for the heart to be good, we have to be interacting well. We have to be relating well with people. We cannot just say, oh, I have to protect my heart and shut down everything else. You don't interact with people. You don't sleep well. You don't eat well, stay active. You're just watching your heart. No, it will still not be where we want it to be. So we want the heart to be functioning optimally all round. And that's why, again, it takes me to wellness. We say wellness, and we defined wellness. We've defined it before. And we said wellness is that personal determination, that effort one makes to maintain, to achieve and maintain a healthy lifestyle. So you achieve it and you maintain it, you protect it, you guard it over your lifetime. So you make it a lifestyle, so it leads you through your lifetime. So you live well and not just exist in pain and agony, but that you live and you're vibrant and that you're healthy, your joints are functioning, you're able to get down, get up, you're able to run and play with your children, grandchildren. That is the fun of living a healthy life. Not that you wouldn't get any disease condition. You may get blood pressure, you may get diabetes, you may get cholesterol, you may get all those, overweight. But the thing is that you are protecting yourself, you're managing those things well, and you're removing everything else that can make those conditions worse. You're informed and educated enough to know what to do to protect yourself, your body, maintain wellness. Because some people have this disease condition and don't even know the ABC of that disease condition. They don't know the pathophysiology. They don't know the goals of care, self-care. Because you have your body, you know your body. You should be the one that knows that disease condition even better than your doctor. You should know your blood sugar, what it should be. Make sure it stays there. You should know your hemoglobin A1C for the diabetics, what it is, and that is at its goal. Your blood pressure, what it should be, and that it's at goal. You are you are you. You have your body. You feel good when these things are good. So you should make efforts to keep them at goal. So when you go to your doctor, you're just informing your doctor, and your doctor can guide you. If there are better medications, better things to do to help, then the doctor guides you. Doctor is your guide, not the main person to to take the lead in that management. If you're well informed, you will be the one leading care. And that's what I want people to do. We've come to that era where people need to know. And today we're talking on cardiovascular health, more on the screening, diagnosis, and management. So screening. So when we talk about cardiovascular health, again, is the heart and the functions of the heart. The heart is a muscular tissue organ that is located in front of our chest wall, more to the left, and it pumps blood. This is our third week of this series. So the first two series we talked more about the functions of the heart, how the muscles contract and relax to pump blood, to receive and pump out blood, and how there are valves and sinus nodes that initiate the impulse, electrical impulse to stimulate that movement, initiate it and trigger that movement to go on forward the right direction so you don't get arrhythmia, and how all these valves will open to allow without being regurgitating, without being weak, so blood is flowing back instead of going the right way or being stenotic, and how the blood vessels would also function to carry the blood along without plaques build up and obstructing flow, or thrombus building up and uh, blocking blood flow. And if there's arrhythmia, what to do. So the heart does this work to send blood to the brain, to the rest of the body, so that everything functions optimally, and the person who has that body is feeling well and moving without having pains and aches, numbness because of poor perfusion, or struggling. So, cardiovascular health. So how do we screen these things? How do we know what to do? How do we take care of these things when to achieve optimal heart health? So the screening, there should be risk stratification. Some people they need to be screened more often, while some others need to be screened less often, like younger ones without any risk factors, no overweight, no sugar issue, no blood pressure issue. They don't need that much screening. So, but older people that are age, so as we get older, our age impacts our cardiovascular health, and that's why we need more frequent screening. So usually it's every year you go for your annual physical, then your doctor can, based on your age, listen to your heart, make sure your heartbeat is normal, check your weight, make sure you're within the right weight. We talked about the body mass index, which is your BMI based on your weight and your height, the ratio. It should be less than 25%. 25 to 30, 29 is overweight, then 30 and above is obesity. So that should be what your doctor is checking each physical when you go. So your doctor evaluates all that and makes sure it's okay. Then your doctor checks your blood, does blood test and check your blood sugar. Make sure your blood sugar is okay, is not too high, that you're not in pre-diabetes range or diabetes, and that your blood pressure is at goal, ideally around 120 over 80, that is no more than 140 over 90. So your doctor checks these things. And your doctor also does blood tests to check cholesterol. So these are some screening things your doctor does. That's why everybody needs to have a primary care doctor who can do these things and guide you. So make sure cholesterol is okay. And our last talk will be more interactive, where I will give different cases and see how you would manage it. So even for healthcare professionals, we would put heads together. So I'll give you a case and see how you would manage it. And it's more talking, our next section is the future of cardiovascular health, and it's more talking to healthcare people, but everybody else can tune in and listen. So we talked about blood pressure, blood sugar, cholesterol, your BMI, body mass index, which is the ratio of your weight to your height, and also your age. That's also put into consideration. So after your doctor has first starts with a history, so your doctor gets a full detailed history, with risk stratification for cardiovascular disease risk. So if there's a family history of early death, somebody with major cardiovascular disease, heart failure, heart attack at a young age, slumping and dying at a young age, which could be a sign of a hypertrophic cardiomyopathy. So they do earlier echocardiogram and assessing the heart function. Um, Family history, your personal history. Have you had any heart attack? Have you had any issues? Then your doctor will, from this history, detailed history, know how much to do for you. Get an EKG, maybe for that physical, um, and do some more testing for inflammatory markers, CBC, chemistry, thyroid. Yes, thyroid function impacts the heart. Some people have hyperthyroidism where the thyroid function is going too fast, and that can overwhelm your heart. It can overwork your heart so it starts getting weak on time, or even hypothyroidism. So when your heart function is so slow, metabolism is so slow, everything is so slow, it can weaken the heart too and make the muscles lax and fail and don't do the function. Also, people who had preeclampsia, hypertension in pregnancy can weaken the heart and lead to postpartum cardiomyopathy. These are all impacts on the heart. So a detailed history by your doctor would help stratify if you have risk of cardiovascular disease and start earlier screening, more detailed screening and testing. Inflammatory markers. Some people have inflammation. They get swelling easily, their legs swell, their fingers swell and get stiff. It can be autoimmune disease condition, your body attacking itself and releasing inflammatory toxins that also impacts the heart and blood vessels and affect you. History of social history. If you smoke, that impacts your cardiovascular health. That's a no-no. Stop smoking. Work more closely with your doctor to find ways to help you quit smoking. It's a hard habit to quit, but it's doable. People have quit without being threatened with a life, event, life-challenging event. They quit. They just say, "Oh no, now I'm wiser. I know smoking can cause me to get my foot amputated, my whole leg amputated. I'm not smoking." Yes, yes, yes. Smoking can do that. It weakens your vessels, your nerves, vital organs. It can start cancer anywhere. It's a slow killer. So, and especially if you smoke and also have sugar issue, if you drink alcohol, all those together can cause somebody to lose their limbs. So some people just need to hear that and they give up smoking. And there are ways without just nicotine replacement. There are some medications because more than 70% of the people who smoke have anxiety issue. And if that anxiety is not addressed, you keep using cigarettes, to fill that anxiety, that space. So it's good to address the anxiety or even depression so that you're not reaching for substance, be it smoking or tobacco smoking, drug use, or alcohol, which all can impact the heart. Some of these drugs cause vasoconstriction, and people can come in with chest pain and they think they're having a heart attack when it's just vasoconstriction from substance use. Alcohol can weaken the heart, lead to failure, so stop drinking. And stress. Stress is a big one, and I can't stop talking about stress impact on the heart, the vessels, arrhythmia, and some vasoconstriction. You see mostly women come into emergency room and you think they're having a heart attack, but it's just a broken heart syndrome. It's just the vessels are narrowed from stress. And then when the cardiologists go in to do cardiac catheterization, the vessels are clear, no plaques, just narrowing, just stress. So stress impacts the body. So if during the risk stratification your doctor finds out you're stressed, maybe it's time to refer you to a counselor or start you on medication to help, because some stress are real, not the day-to-day usual day-to-day stress we go through, but real stress that keep people up at night. They're not sleeping well, and slowly it weakens the body, and that needs to be addressed on time to reduce complications. And that takes me to the next topic. So why do we need to get screened? I mean, I'm feeling good, I'm okay, I don't need to see a doctor. Yes, everybody needs to be screened. I don't know, me too, Evangeline, I don't know how well I am without getting checked out. So every year I get my own annual physical. My doctor listens to me, my doctor does blood tests, EKG, and sometimes more depending on what is needed. You can get imaging if it's needed, CT scan, MRI. People wonder why is somebody getting that. Yeah, if you do your physical and there's need to get those checked, make sure everything is okay, those are done. um, so you're the early screening, getting screened, what it does is it helps prevent disease conditions, especially since we're doing cardiovascular health, cardiovascular diseases. So when we get screened, make sure everything is okay, fine, okay, everything is fine, continue what you're doing. When we get screened and it's like they say pre-hypertensive, pre-diabetes, if it's not quite there, it is still preventable. Then you do the good things, do the right things to bring it down to normal. Some people have brought their cholesterol back to normal just by the right advice, being screened and advised. While some people, sugar is a little high, pre-diabetes, and they watched what they ate, exercised more, and they brought it down. While other people, blood pressure is high, cut back on salt, stay active more, or maybe stop certain medications or certain drinks or tobacco use. Do you know that energy drinks, some young people, especially during exams, they want to stay awake and study and they reach for energy drinks. All those, or coffee, a lot of those caffeinated drinks can raise blood pressure. So during that time, your blood pressure can be high and may cause some damage to the body. And also, when we eat noodles, some family, they buy packs of all these noodles with all the seasonings and they load it on children's food, and children who eat this may start on time to have early blood pressure that is not identified. And your sustained high blood pressure can affect the kidneys, not just the heart, the kidneys too. You see young people early age on dialysis, that is a heartbreak. So please, we start on time to prevent these things. Don't feed the children all those noodles with all the seasonings. Even if you have to give them, don't use those seasonings. Maybe just a teeny bit. If you can avoid it, avoid them. Watch your seasonings. Use spices. There are healthy spices, cilantro you can put in food. It makes it taste good without all the sodium in this processed food, and all the chips and canned and bagged foods. We stay away from those because they can raise blood pressure and affect the body. So again, what does early screening do for us? Besides prevention, it helps prevent disease conditions. Again, if it's then you work on it so you don't get to the actual actual diabetes or blood pressure, whatever is you prevent that disease conditions and the complications that go with them. Because like for instance, if we take diabetes, we talked about amputations, losing your limbs just from sugar being high, and maybe you also smoke and drink some alcohol. Yes, people have lost their limbs. It can lead to kidney failure requiring dialysis. That is not a way to live. People, every 3 days a week or more, you're in dialysis center getting dialysis. That day is gone. Those people may not be able to keep a job, and it's stress for that person. their family who may be taking them or taking care of them, and the whole community and the country, because it's money, insurance pays for all this. So we need to just start on time to make effort at being well. We feel well, nothing like that. You sleep and wake up, you're not aching, you're not hurting, you're not burning somewhere, bloated, you're not, you feel good and grateful. So the other thing is, I already mentioned, with early screening, it prevents disease conditions, complications. It reduces stress, family stress, stress for the person who has a condition, and stress for the family, the loved ones who are there day to day watching that person suffer. It's like everybody suffers. So that's why it is very vital, that we be aware, be informed, and prevent these things. That's why Dr. Evangeline Obi is always open and willing to give this talk so people learn and protect themselves and prevent harm and stress, not just to themselves, but to those around them and the nation at large. Because when one suffers, somehow others suffer too. So let's work together. And with MyAFA Incorporated, which is a nonprofit, we do this talks so to help. And if you need a physician or need more one-on-one, that's where Ministry Wellness Center come in and can help more and guide. So let's help reduce cost burden. So we do this screening. We talked about your doctor checking blood pressure, blood sugar, cholesterol, your waist circumference, your weight, BMI, and screen you for substance use. Make sure you're not smoking, drinking alcohol, or using drugs. Then if you have these conditions, what do? If it's blood pressure, usually salt increases blood pressure. You know the risk factors for blood pressure. Salt is one, and salt is not just the salt we cook with. Salt in processed food, canned food, bagged food, salt in seasonings we use in cooking. Avoid those salts. Avoid those at all costs. And then exercise. Stay active on a steady, consistent basis. Not just once a month you go to the gym, but consistently you exercise. Then the other thing is that you if you've done all these and you do not stress too much. If you have issues with sleep, if it's from stress, talk to a counselor. Stay on medication to help calm your nerves so you can sleep. But if you've done all these and still not doing well and need medication, your blood pressure is still high, greater than 140/90, because that should be, your goal is to keep it below that. So if it continues to be 140/90 or higher, then talk to your doctor and be on the right medication. When I say the right medication, it depends on other conditions you may have. Your doctor will know what is the best blood pressure medicine for you. If you're African American, there is a better blood pressure medicine for African Americans. If you're Caucasian, there is one for Caucasians that is best for them based on study. If you have diabetes, in addition to blood pressure, there are a class of medications that diabetics need to be on to control not just the blood pressure, but to provide cardiac and renal protection. Then if you have heart failure, there are medications that are best for those with heart failure or heart attack, have had heart attack. So based on your condition, your doctor will know which was the best. And if you have thyroid issues or palpitations where your heart rate is high, then there are also medications called beta blockers just to slow your heart rate and help you. So your doctor will guide you on being on the right medication. Then the next thing is if we have diabetes. So if it's diabetes that we're screened and we're found to have high blood sugar, that you cut back on high calorie food, cut back on those. Stay active still. Everything, you notice everything has activity in it. Exercise. Exercise is not just going to the gym. You don't wait until you can go to the gym, because I tell you, I know some people love the gym, but not everybody can be up and to the gym every day. So find things you can do in your home. Me too, I need that. I'm talking, don't think I do it all, but I know I'm just giving information, and I'm praying that I can do it routinely, like steadily too. So, um, exercise, dancing, have a treadmill at home, run around with the children, trampoline, jump and play. That's what we used to do when we were younger, and it helped our heartbeat. It helped us stay happy, not just happy, but maintains our health. Happiness helps the heart a lot. So do all you can to be positive, to be happy, to stay active, even if you don't do anything else. Do those, eat healthy still, make the right choices, more of vegetables, less of carbohydrates and fatty, greasy food, some protein. Do those. Nuts are good. They say Mediterranean diet and the diets appropriate to stop hypertension, called, you may hear, the DASH diet. Those are the ones we usually recommend for heart health. So do all those that will help you maintain a healthy heart. Then, if it's cholesterol that is the issue, then of course stay away from fatty food. Stay away from fatty food. So I can't see myself. Stay away from fatty food so your cholesterol doesn't go too high, and your doctor will know the right time to put you on medication. So you don't jump on medication just because a number in your cholesterol is high. It has to be to the point where you need medicine based on a calculation before your doctor starts you on the medication. So, and the next thing, if it's your weight, then again, stay active, less stress, because stress can make your weight keep rising. Besides what you eat and not exercising, stress causes stress fat, and you gain more weight. So just make sure you take care of those and you're sleeping well. Self-love. Love your body, love yourself, take care of yourself, avoid substance use, smoking, alcohol, drug use, and have a support group to help you with stress. If you're stressed, know your limits and ask for help. Do not be shy. Ask for help when needed to deal with that stress. Some stress are acute, and in that acute phase, you need to talk to someone. You need real help, and try and get that help. But other stress are just things we go through day to day to day. Just pray that I don't know how, whatever helps you through stress. But for me, prayer helps a lot. At least I know that if I can't do this myself, I have a higher power that's watching over me and knows what's best for me, will save me through this situation. And he always comes through. Just make sure you too, you're doing the right things. Be at peace with your own mind. And the scripture I want to use here is Hebrew 12:14. Pursue peace with all men. You cannot be envious, jealous, rivalry, bitter in your heart and think it will be well. Especially for somebody who hasn't done anything to you. But even for those who have done something to you, keep an open mind. Pursue peace with all men. You did not say with some men. Because the one who takes care of everything knows how best to take care of that situation. Some people might be hurting you or think they are using you or whatever they are doing. In their bitterness of heart, the one you listen to will see you through. Always remember that. So you don't go to fight or be like them and get yourself in trouble. Just maintain peace. Maintain your peace. That way you can lay down and sleep. Be at peace. Wake up. Your body is rejuvenating. Your body is healing, repairing. And while they are there concocting their evil and hurting themselves, and at the end of the day, they will lose. They will lose the battle. So anyway, be at peace at all times. And if you've done all these good things, all these positive things we've talked about, and you have disease conditioned, a heart that needs help, make sure you're working with a great cardiologist and a primary care doctor. Get the right testings and referrals done on time to take care of that condition. Okay? There's EKG, echocardiogram, there are electrocardioversion, electrocardiac things they do. There are the surgery, cardiac catheterization to remove plaques and the vessels to put stents. There are different things the cardiologist can do to help. You can wear a life vest, a pacemaker. They can put a pacemaker. They can put an AICD just to help keep the rhythm and the beating of the heart in order, so it's not going the wrong way. So talk to the right people and start on time. Do not wait until things are all so bad. If you get periodic chest pain, you may need a stress test, because maybe when you see your doctor, the pain is not there anymore, and your doctor can refer you to a cardiologist. If they don't do that, the stress testing. So they do the stress test and see if they can reproduce that pain and see what exactly is happening and address it on time. So cardiovascular health is a big area, and I just summarized most of this so people know. So take care of yourselves. Remember, be at peace with everyone. Pursue peace with all men. Hebrew 12:14. And love yourself. Love yourself so that you cannot give what you do not have. If you're able to acknowledge yourself, love yourself, then you can be able to love somebody else. Then somebody else can see that love in you glowing and can love themselves back or learn to love others. So let's learn to love ourselves and then learn to reach out, helping hand, help someone somehow, someday, so that at the end of the day, we are all living the way our Creator meant for us to live, in peace, in harmony, being great achievers in all that we do, growing, multiplying, raising healthy children, grandchildren, community, nation, and just at peace, growing older, healthier lives. So I think we talked about some of the blood tests that are done and the monitoring. I think with that we come to the end of this talk. And again, this is Ministry Wellness Center, and it's also Mayafa Incorporated, bringing this talk through Dr. Evangeline Obi. And I hope somebody learned something today that may want to share or ask questions if there are any questions. So others will also learn from people's experience. We can be reached at info@ministrywellnesscenter.com or Mayafa Incorporated, which is MYAFAINC@gmail.com. These are our emails, or you can go to ministrywellnesscenter.com website and contact us. Send us a message and we'll reach out to you. Okay? Keep being informed, keep being intentional, keep learning, be proactive, take care of your health, and be prayerful in all that you do, so that we all will reach our goal in life. Thank you all for listening, for connecting, and I hope you will connect again next week, same time, 11 a.m. We'll be talking more on cardiovascular health, looking at over everything we've done this past 3 weeks, and ask that will be more interactive because I'll be asking questions. I would give cases so we know how we approach it, and I hope you come prepared with questions and answers and comments so we can all talk. Thank you all. Bye. I can take any question or comment. Okay. Thank you all. Love you.